Your name, please?
Yes, my name is Randal Pinto.
And what is it that you do here, Rand?
I'm a professional acupuncture practitioner, and I've been in clinical practice for 25 years now.
Wonderful. Okay, so in terms of your role, what you do, could you give us a little bit more detail in terms of the most common kind of treatments or most common things that people come to you with?
Sure. We see more commonly musculoskeletal issues, so everything from tennis elbow, frozen shoulder, rotator cuff injury to the osteoarthritic patterns, for example, osteoarthritis of the knee, lower back issues, lumbar problems, sciatica. So those are the most common cases that we treat. We've also got cases of supporting people with asthma, respiratory issues, including the common cold, sore throats, that kind of thing. And to the more complicated issues of supporting people going through chemotherapy, radiotherapy for cancer. So again, just boosting up the immune system and their chances of helping get their bloods back to normality.
Okay. So there's a wide range, obviously, that you're covering there. What about the age range, for example, of who you're seeing?
The youngest patient I've treated is 3 days old with colic, and the oldest patient is 94 at the moment. So we're supporting an older person who's at the moment cannot have their knees replaced, and so are having to have acupuncture for pain relief in connection with their GP's treatment and supporting them with their conventional medical treatment.
Okay. And when people come to you over these courses, there's obviously the physical element of what's wrong with them and they want fixed, but do you tend to see any other side? Are there any kind of side issues they come to you with, anxiety, etc.?
I mean, the amazing thing with acupuncture is we treat the whole body. And acupuncture, as far as we know, has been around for at least 1,000 years of documented evidence in China. And we currently treat people with headaches, anxiety, panic attacks. And the way the acupuncture works with those kind of emotional issues is by improving the blood supply to the brain, helping to release naturally occurring serotonin in the brain, to help people, instead of having a closed-in, narrow, tunnel vision perspective. Serotonin is lovely, kind of happy hormone that gives people a bigger perspective in their life, so they can then start implementing the changes they need. And so we see acupuncture almost as a complementary form, not really alternative, that's a bad word in my books. It's a complementary form of medicine that supports whatever treatment patients are having from their GPs or their conventional consultants, or any other form of physiotherapy, osteopathy, or chiropractic. So it's quite amazing, you know. So I'm a little in between therapist that supports a person moving forward, but also supports the community and the other therapists that I'm working with here.
Great. Okay, so when someone comes to see you, presumably they're like going to the dentist, for example. There was a little bit of anxiety in terms of exactly what's going to happen. Yeah. Are you going to stick a big massive needle into me? So what does it actually look like? What does it actually feel like?
Well, over here we've got how a size, in fact, of how small the needles are. So we've got two different sizes of needles that I tend to use. The finest needle here is 0.16 mils in diameter, and the average thickness is 0.18. So they're I can probably stick about 7 to 10 of these needles into the hole of a hypodermic syringe needle when they're taking blood, for example. So these are very fine. And if you ask me, has any of the kids that I've treated in the last 25 years of clinical practice, if anyone has cried, and I'm happy to say, or pleased to say, that no one has cried with the insertion or the extraction of these needles, including the babies. And they just get a bit upset about having to leave my warm, cozy, comfortable room, you know. So these are very, very fine. They're pre-sterilized disposable needles. They only get used once, and they're incinerated after use. Yeah, so pretty amazing. We can average between 1 to 2 needles in young people. to, on average, between 10, 12 in an adult. And treating skin conditions like shingles, for example, we might use mite more to surround the rash that people have with that condition.
Okay, it's probably quite hard to say because obviously you've got such a wide range, such a plethora of people seeing you in treatments. So if I was to ask you what's kind of like the average treatment time over a number of weeks or months, is that something that you potentially could...
Yeah. In fact, for example, with the osteoarthritic cases that we see, if the osteoarthritis is quite advanced, we're looking at a minimum course of 8 to 12 treatments. And that is a treatment protocol that's been recommended by colleagues that are working within the NHS to have an effective form of relief from their pain. If we're supporting people with fertility, for example, we're working alongside the fertility consultants locally. Ideally, we'd like to see people 3 months before they start their fertility treatment, so as to enhance the circulation to the ovaries, to the uterus, to improve the thickness of the uterine walls, and also to improve the quality of the egg or the sperm. And in those cases, we found that the geneticists and the embryologists that were doing research on acupuncture found that 3 months gives us adequate time to improve the quality of the egg and the sperm.
Okay, could you tell me what the common conditions are of patients that are coming in to...
Sure. I've got a lovely poster here that kind of gives us an idea of the common things that I see in clinic. And it also summarizes acupuncture being safe, gentle, effective. It can support people in pregnancy as well as fertility. It can support the young and the old. And it's got my clinic details on there as well.